Well, the National Education, Health and Allied Workers Union is going to continue with its strike despite numerous court interdicts. It's compromising healthcare, of course, for patients. As has been reported, 4 patients are believed to have died, while some people have been turned away at hospital gates. Surgeries have been cancelled and ambulances have been unable to respond. While the cost of living ballooning, the public servants are demanding a 10% wage increase at this point. Government, of course, doesn't seem to be budging. They're offering 4.7. Let's get reaction then from the chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, a regular guest here on the show and always grateful for his time. Doctor, good morning. So first of all, before we talk about your thoughts on the strike action and how this could have been handled better, I do need to ask you, and I'm sure you'd like to talk about the impact on health for patients, because in the end, that is who's being affected badly here. People have possibly died. Good morning.
Good morning to you, Gareth, and good morning to your viewers as well. Gareth, the impact is huge. Like you've heard already, reports that some patients have already died. I don't think it's only 4 patients. I think it's more than that. But also the impact on the backlog of surgeries that have been always there since COVID-19, but also emergency operations that cannot be performed because there's no staff. Babies who are admitted cannot be fed. ICU as well. There's no staff in the ICU. Patients are at risk of dying. There's many things, including patients who are coming to collect their chronic medication or cannot access hospitals. So it's quite a huge problem in terms of healthcare delivery.
Essentially, we could have a direct correlation, and I'm going to talk to an attorney about this later, Doctor. We could have a direct correlation between striking workers who refused entry into healthcare facilities and people dying. I mean, this has got to be bordering illegal. Of course, it's illegal. I mean, how upsetting is this for you as a professional in this field to see people dying because protests are taking place?
Well, it feels, we feel very sad. In fact, we feel very sad that government has allowed this to continue like this. When they have not remunerated well the healthcare sector, and they continue to call us heroes and heroines, a lip service that we've always been observing since COVID-19. So we are where we are because government has been tardy in terms of ending the relations between the healthcare workers or even the workforce in this country, when they renege from the agreements that have been in place. So patients are dying because there's no plan in place by government to make sure that if there's a strike, we can always have the military that is trained in healthcare to come in and assist in the surgeries, come in and assist in the wards, give medication to patients. But what is happening now, we have a minister who has a chest-out approach, to tell the public that patients have already died, when actually he has not come up with a plan to mitigate against those. So that's what is disturbing the Medical Association.
And as an organisation that works at the coalface of this particular issue as well, Doctor, what would you want the health minister to do? How should he have done this better? It obviously hasn't happened now, but how should he do this better? Is he the only person that can bring this to an end? What would you recommend how to do this and bring this to an end?
I would recommend the health minister, one, to work with his colleagues, including the security cluster, but also there should be plans in place, making sure that the military is aware that there could be a disaster in terms of management of patients. So those military guys who are trained in healthcare should have been taken in as soon as the strike starts, intimidating people who are coming in. But also making sure that police are out there, making sure that we avoid the blockage of patients into the hospitals, making sure that there is no arson, there is no destruction of property, because we know what it takes, in this country when you destroy a property. So those are all the things that I thought the minister would have done long before when they talk about strike. And this strike, by the way, Gareth, could intensify. You could have other unions joining in. We should be already having a plan in place, making sure that we're not surprised. Making media statements and all these things does not help when you do not have a plan in place.
So let's now talk about the behavior of the unions, because this is not all unions. Speaking to Terry Bell, Labour analyst, yesterday, he was saying we need to make sure that we are talking about only the one which seems to be in question here, which is NEHAWU, even stopping other medical workers from represented by other unions, like the PSA, for example, from getting into work. What they're doing, is the common view, is they're holding the medical fraternity, medical doctors and patients to hostage. Is that your view as well? Do you feel this is an unfair way to go about this, that they're holding people's lives at ransom?
Yeah, Gareth, the first thing I think I do want to state it publicly that we support, the frustrations, or should I say the challenges, that are facing, or the strike that, NEHAWU and other unions have embarked on. We understand, we were on record complaining about the conditions of service, complaining about the poor recognition and compensation for healthcare workers. So we understand where they're coming from and we support them. But what we do not support is when, unions begin to block entrances to hospitals, they become destroy infrastructure, and the way they handle themselves in terms of intimidating even those doctors that are going to assist patients and nurses. So that is what we are worried about, to say, but we understand the strike and we support the strike. But what is happening now? Why are you taking your anger and your frustrations out to patients when you know where the politicians are, where their offices are? And we know, Gareth, that this is a NEHAWU and other unions are affiliates of COSATU. And COSATU is an alliance to the ANC, the ruling party. Why can't they discuss these things internally instead of, making other people victims and making other people die, because they can't handle themselves? This is disappointing. This is poor leadership.
Do you think that if this is not brought to an end very, very quickly, Doctor, I think I'll make this my last question for the moment with you, Dr. Mzukwa, if this doesn't come to an end, possibly by the end of today or the weekend, we are going to see more people dying as a direct result of the strike action. Is that your fear?
Like I said earlier on, Gareth, we believe that there's more than 4 patients who have died because of the impact of the strike. And if you continue like this, more patients obviously are going to die. And what it will make things worse is the unavailability of the plan mitigating factors, making sure that, whatever impact the strike has on in terms of healthcare does not cause death of patients and everything else. Now we are sitting with people who are reactive, people who don't have a plan, people who are frustrated like we are, yet they are leaders in healthcare.
Very worrying indeed, and I appreciate your views this morning, as worrying as they are. Dr. Mvuyisi Mzukwa is the SA Medical Association Chairperson, or SAMA if you prefer the acronym, making time for us this morning here on the show. Very worrying that if something's not done soon, that there could be even more lives that are lost. Our team will be out and about at the various healthcare facilities throughout this morning and throughout today, still getting a sense of where we are in the strike action, speaking to protesters, speaking to leadership, and of course also speaking to patients who have been adversely affected.